Assistant Secretary of Health and a member of the President's Coronavirus Task Force, Admiral Brett Giror. Admiral Giror, welcome back to Meet the Press. And I want to start with something that my colleague Jose Diaz-Balart asked the President. He asked him, it looks like we're losing this war. The President says we're winning. But honestly, Admiral, it does look like we're right back to where we were in April, which to a lot of lay people looks like we are losing this battle with the virus. What do you say?
So thank you for having me on. We're definitely not losing the battle, but we are certainly in the midst of it. I think, as you know, the numbers of cases have gone up recently, particularly over the last month. We have several hotspots. Some good news is that our positivity rate is leveling off. We have about 63,000 people in the hospital. That's a lot more than 40,000, a lot less than 85,000. And we do have a lot more tools in our toolbox right now to combat this. But I don't want to underestimate the seriousness of this right now. It's all hand on decks. We have people in the field assisting essentially every county, every hotspot. So we are in the midst of this, and we're taking it very seriously.
Here's what I don't understand, though. In March and April, it was understandable that we didn't have enough PPE. In March and April, it was understandable we were still trying to ramp up testing. In March and April, it was understandable that it might take a few days to get results. We didn't have contact tracers. The whole point of the April shutdown was to get PPE and an inventory so that we wouldn't run out. Have testing so that it was reliable and fast. We are running into the same problems that we were talking about in April now in Arizona, in Texas, and Florida. Why?
Well, that's really not true. If you look at the data, and we follow the data every single day, over 75% of the hospitals have at least 15 days of PPE in supply, and less than 2% have under 3 days in supply. The PPE situation is in a much, much, much better place. And in fact, we're really ready to attack this. I'm not saying that there's not a shortage at one hospital or there's a maldistribution, but overall, we have lots of PPE. In terms of testing, we did over 800,000 tests on Friday. We've tripled, quadrupled the number of tests we have. We have over 2,000 retail sites. 1,300 federally qualified health centers are there, and we're surging testing in basically every specific county that's having a problem. So it is not true that we're the same where we are in March or April. We are much better prepared. We have much more tools, and we're attacking it aggressively.
But Admiral, the testing situation, yes, we're getting more tests, but we're not getting the results fast enough. It takes 5, 6, sometimes 7 days in some of these hotspots. So you can't do contact tracing under that circumstance. You really got to look at the data, okay? You're looking at the data on half the testing, which is the large commercial labs. The other half of the testing is point-of-care testing or within hospital systems. Point-of-care testing gets you a result in 15 minutes, and the hospitals are usually providing it in 24 to 36 hours. On the big commercial labs, if you're hospitalized, you get it in 24 to 36 hours. But you are right. We need to decrease the time to turn around those results. And we have a number of efforts. Number one, we're starting to work with them on pooling. We expect to see that very soon. And number two, the big surge is because we're testing everyone in nursing homes. That's a really, really good thing. But that's millions of tests per month to protect our elderly. And we're going to fix that problem. And you'll hear more this week about us putting point-of-care testing in nursing homes. So we are aggressively attacking this. Every night, I get a report by state. What is the turnaround time? What is the delay? And actually, in Arizona, Florida, and Texas, the turnaround time has improved over the last 30 days. It hasn't going up. So we follow these data, and I look at that every single night, morning. It's the first thing I do when I get up, last thing I do before I go to bed. I want to get you to respond to something Dr. Michael Osterholm said to me on Friday. Take a listen, sir.
The way we're going to end up, I think, maximizing on our overall safety, our health, and our economy is getting it shut down once and for all, coming back slowly and gradually, much like New York is doing, and the rest of the world, and then living with it until we get a vaccine.
Is there he's basically advocating, in order to get control of this, we got to shut down right. We didn't shut down correctly the first time. Do you concur with that opinion that we didn't get this right the first time?
I think Mike's a really smart guy, and I listen to a lot of things he says. I read his newsletter. We're going to have him very involved. But I don't think we need to shut down, at least in most places around the country. Our models really show
that if you close down bars where there's a lot of transmission, if you decrease restaurant capacity to about 50%, that you really strictly physically distance, and really everybody, if you're out in public, we have to have about 95% mask wearing or face coverings. If we do just those simple things, we can bring that R value, that transmissibility value down to below 1, which means it goes away. So I think we need to be very selective. Sure, if we shut everything down again, that would do it, but we don't need to. And remember, there's a tremendous health cost to shutting down: mental, emotional, substance use, but also no cancer screenings, no vaccines, all those other things. So let's do what we know really works. Like I said, avoid bars because they really do spread. Restaurant capacity down 50%, hand hygiene, and please wear a mask in public. That is really, really, really important. We've got to have 90 or 95% adherence to that, and we could achieve the same results.
You know, I want to follow up on the mask thing. A mask ordinance was not something that anybody on the federal level was talking about a lot in March and April, and of course the president himself has been at times acting like almost an opponent to mask wearing. How much did that set us back, this political debate about mask wearing over that 3-month period?
Well, I think the public health people have been very, very clear that mask wearing is essential. It's very important that we can really decrease the transmission. You may not protect yourself, but you really protect everyone else. And the Surgeon General says it very well. COVID stops with me. If you want it to stop with you, wear a mask. And we really want to emphasize that, and particularly with some new data that there might be a small amount of aerosol transmission, particularly in very closed spaces with poor ventilation. Mask wearing is really important. So we've been very, very clear about that. Combined with the testing that we have right now to tell us exactly when a hotspot is starting, and our commercial labs have done a great job in doing that, doing about half our testing. Combining with that, we have a really good signal radar to know where to surge in, combined with the techniques that we have. And again, we're sending out COVID response assistance teams. We sent it out to 10 different locations last week. We're going to do another 9. That's 19 major metroplexes. You know, we know what to do with this, but we've got to have people on board doing it. And if you do get sick, the good news is we know how to treat you better on the ventilator. We have dexamethasone, remdesivir. The mortality rate is going very, very much down. But all this, look, I'm not trying to paint a rosy picture, but we are definitely in a better spot than we were in March and April, but we have to take this incredibly seriously, and I think everyone in the country is doing that.
Admiral, I understand that you believe in, and I'm sure on logistics that we are in a better place, that we have some of these things that we've streamlined this process. But results, sir, look at Europe and look at us. Why are we have such a different and poor outcome than Europe?
Well, first of all, if you look at much of Europe right now, you're seeing some resurgence in cases. So I think the book is still out on that. This virus is not done with humanity yet. Probably only 10% at most of people who have had it. So there are a lot of susceptible people. What we really have to do, and we have to be absolutely disciplined about that, is we have to do the kinds of mitigation techniques that we've been talking about. On the testing side, we have good early signals now. We know that an increase in positivity heralds the rest down the line. An increase in positivity will mean an increase in infections about a week later, which will mean emergency room hospitalizations and, unfortunately, deaths. When we see that, you have to be absolutely rigorous and disciplined about those measures. If we do that, we can turn that around. And again, early signs in almost every county right now. We have had an upsurge in cases. Early signs are that that's starting to level off, but we've got to keep the foot on the gas because we have a long way to go before this is over.
And the final question I have for you is whether on this task force, whether public health guidance is being sort of massaged a little bit. This was from the Washington Post about Anthony Fauci. It says Dr. Fauci has argued that parts of the country experiencing surges should shut down. But there is no buy-in for that, said an official with direct knowledge of the conversation who spoke on a condition of anonymity. Are there some ideas that you can't propose because the president will never accept them?
I want to just put this to rest. There is complete, open, honest discussion within the task force. The task force meets 3 or 4 times a week. The vice president calls me regularly.
Dr. Birx is not one to hold her tongue. Believe me, if there's a public health opinion that needs to be said, that needs to be it. And I respect Dr. Fauci a lot, but Dr. Fauci is not 100% right, and he also doesn't necessarily, and he admits that, have the whole national interest in mind. He looks at it from a very narrow public health point of view. But let me just say, there is absolutely open discourse. I feel absolutely free saying anything to the vice president within those rooms. The vice president, I know, briefs the president on a daily basis. So nobody feels like anything is held back. We all take this as a serious crisis. It's got to be science driving the policy, and that's the way it is.
Admiral Giror, I'm going to have to leave it there. I appreciate you coming on and sharing the administration's perspective, sir. Thank you.
Thank you.
Hello from Washington, I'm Chuck Todd, and thanks for checking out the Meet the Press channel on YouTube. Click on the button down here to subscribe and click over here to watch the latest interviews, highlights, and other digital exclusives.